Republican leaders are making more progress on a plan to repeal and replace Obamacare, with legislation set to be officially introduced in just 10 days. Congressman Brady, you met with other Republicans today. What can you tell us about the specifics of this plan today?
So what we're looking at is going beyond repeal and really laying the foundation for patient-centered health care. It's going to include, in our discussions today, what we're proposing are more of a free market, so allowing customers, patients, to have bigger health savings accounts to handle the out-of-pocket costs, the creation of an individual tax credit to help people choose a plan who don't get it at work or in a government program like Medicare, for example, but those small businesses, mom and pops, those entrepreneurs, those early retirees, the opportunity to pick a plan that's right for them.
Are you doing away with the mandate?
Specifics. Yes, we are. The penalties that go with both the employer mandate and the individual mandate.
Are you restoring catastrophic insurance so that people don't have to buy insurance plans that have all the different things attached to them? If they want to just get it for the big emergency, can they do that?
So that's what we're trying to put in place to allow people now to buy catastrophic plans off the exchanges. But I think the real answer is going to be give states the power to approve plans that actually work for their state. Those are what we're working on in this proposal.
How do you pay for all of this? Because the problem is, I mean, the things that you took away, no one likes those, but getting healthy people to pay for sick people was the principle that was going to make the whole system work. So if you don't force those healthy people through the mandate and through the big, heavy plans to pay for everybody else, how do you pay for the people with pre-existing conditions?
Hey, forcing them isn't working now.
Right.
You know, in most states, more than half are paying the penalty. So give them plans they actually need and can use, and then actually travels with them throughout their life. It is a different approach than forcing people into plans they can't afford and frankly can't use. So the mandates have failed miserably.
They've definitely failed. I don't mean to interrupt you, sir, but we only have so much time. For the people that are consuming a ton, how do you pay for it?
Again, so we're going to have savings from Medicaid savings. We're going to have savings from repealing the subsidies, which are not working and hugely expensive. And we're looking at some other options, including unlocking the tax break you get only at work and allowing you to take it with you if you're in between jobs or you're starting your own business or raising your family.
Speaker Ryan said that with respect to pre-existing conditions, we think the smarter, better policy is to revitalize our risk pools at the state level with federal financing. It sounds like you're going to take federal dollars to pay for the people who consume a lot of health care with pre-existing conditions. Is that right?
So, yes, right now, all that's in the same pool, one of the big drivers of this. So if you separate and give them good quality health care, because we know they have high costs, it lowers the premiums for other Americans and also helps draw in those younger, healthier Americans who've just rejected Obamacare.
Wow. I mean, Congressman, thank you. That's an honest answer. We'll see if that works.
Thank you.
Appreciate your time, sir. Thank you.
You bet.